Occupational Therapy Process for Neonatal Feeding Problems by Brandy Herrera and Maydelis Peña for Kaiser University.
Baby Jane has not mastered the suck-swallow reflex because it usually develops later on in gestation. It consists of the infant opening their mouth to latch onto the nipple when their lips are touched and sequencing sucking, swallowing, and breathing. Baby Jane was also born with a tongue tie, which affects the infant's oral development because it reduces the amount of movement the tongue has. When the movement of the tongue is restricted, it limits the baby's ability to breastfeed, interferes with speech development, and oral hygiene. Jane has also been receiving her nutrition from a nasal gastric tube that is inserted in her nose and runs directly to her stomach. She is beginning to transition to oral feedings.
When we talk about how occupational performance is affected for a premature baby, we might think that there is not much affected since they do not seem to have many occupations. However, their ability to feed and sleep, as well as the ability to socially interact with their parents and the environment, are highly affected. In addition, oral motor skills are affected, which causes problems with language and social abilities later in life. For baby Jane, some of the advantages she has is that her rooting reflex has appeared. She has no other medical diagnosis, and her caregivers are receiving education from multidisciplinary teams. On the other hand, some concerns for baby Jane include having a nasogastric tube or an NG tube, which is taped to her cheeks to hold it in place, and she also has tongue tie, affecting her ability to properly latch on her mother's breast or a bottle nipple, which creates an increased difficulty to obtain proper nourishment.
Some of the factors and characteristics go hand in hand with neonatal feeding problems. They include the inability to synchronize a suck, swallow, and breathe in pattern that has not yet been developed. Jane was born at 29 and a half weeks of gestation, and the suck swallow reflex is not fully developed until 32 to 34 weeks of gestation. Also, tongue tie can be a factor causing feeding problems as it restricts the tongue movement. Additionally, the ability to remain physiologically stable by maintaining adequate heart rate and oxygen saturation while feeding is important to keep in consideration for premature infants with feeding problems. Lastly, the ability for the infant and caregivers to engage in an infant-driven feeding program is important as it allows the caregiver to recognize and react to hunger cues from the infant.
As OT practitioners, we use models of practice and frames of reference to assist us in identifying the client's problems and to help us create an occupation-based plan of care. For our patient Jane, we have decided to use the synthesis of child, occupational performance, and environment in time frame of reference, along with the model of the process for establishing children's occupation, and also the occupational therapy intervention process model. The synthesis of child, occupational performance, and environment in time is a frame of references that enhances a childhood occupations through a holistic approach and focuses on the child's ability to engage in occupations. It can be used for infants with feeding problems as it provides OT practitioners the ability to develop interventions allowing the infant to interact with their environment and the occupation at the same time. The model of the process for establishing children's occupation, or PECO, focuses on the child's process of learning, which is repeated over the course of their childhood and is associated with the child's behaviors. PECO can be used when infants experience feeding problems as they go through a process of learning new skills. Occupational therapy intervention process model is a client-centered approach that focuses on the adaptation of tasks in order to facilitate occupation's performance. For infants with feeding problems, this model is appropriate because we're teaching the parents and caregivers to utilize positions while feeding and different types of bottle nipples or breast shields to make it possible for the infant to initiate feeding as an occupation.
This chart shows the information collected and organizes the beginning steps of the OT process.